You're over 70. You take more than one medication. The antibiotic most doctors reach for first can interact with what's already in your cabinet. And that interaction can be more dangerous than the infection itself. Some seniors have ended up in the emergency room within days of starting treatment, not because of the parasite, but because of the prescription meant to clear it. There's a list of 6 questions that need answers before that prescription gets filled. Don't end up in the ER. Make sure you know what to ask. Barbara was 71 years old and had been on a blood thinner called Warfarin for 3 years. She knew her routine. She knew which foods to watch. When explosive diarrhea hit in late July, her husband drove her to urgent care that same afternoon. The doctor confirmed it was the outbreak strain. He called in an antibiotic called Bactrim. He told her she would feel better in a few days. She picked it up, went home, and took the first dose with dinner. 4 days later, she was in the emergency room. Her gums were bleeding and wouldn't stop. Bruises had appeared across both forearms overnight. Her blood thinner dose hadn't changed. Her diet hadn't changed. What had changed was the antibiotic on her kitchen counter, and nobody had told her those 2 things couldn't safely share a medicine cabinet. This isn't about avoiding the antibiotic. It's about walking into that appointment knowing exactly what your doctor needs to hear before they write it. The people who never hear this keep picking up that prescription without asking a single question. The ones who do hear it ask 6 things first, and the outcome changes. I'll start with what that antibiotic does inside your body when you're already taking pills every morning. A senior gets a correct diagnosis and a correct prescription, and then lands in the ER because of an interaction that's documented, predictable, and almost never mentioned at the pharmacy counter. Before I go further, are you on a blood thinner or a blood pressure pill? Have you or someone you love had a reaction to an antibiotic that nobody warned you about? Tell me in the comments. I read every one. So here's the thing. Most people over 70 take more than one medication every morning. That's normal. What changes with this outbreak is that the antibiotic doctors prescribe most often for it, Bactrim, has a job to do inside your body that overlaps with the jobs your other pills are already doing. Think of it this way. Imagine 2 workers assigned to the same narrow hallway. Separately, each one is fine. Together, they block the passage. That's what happens with several common drug combinations here. Your body controls certain things through very precise systems. How thin your blood is, how much potassium stays in your body, how your heart beats. Those systems depend on every medication doing its own job at the right level. Bactrim steps into that hallway and changes the math. The result isn't always obvious. It doesn't always feel like a reaction. Sometimes it looks like bruising. Sometimes it looks like muscle weakness. Sometimes it looks like your blood sugar dropping for no reason. And sometimes, if no one catches it, it looks like a medical emergency. First up, if you're on a blood thinner. Warfarin's the one to watch for. The FDA's own prescribing information for Bactrim states this directly. This antibiotic can make your blood dangerously thin within just a few days, well before your next scheduled check. The signs are specific. Bruising you didn't bump into anything to get. Bleeding from your gums that won't stop. Blood in your urine. If you see any of those, don't wait for your next appointment. Call and ask for a blood level check within 2 to 3 days of starting the antibiotic. That's what Barbara's anticoagulation nurse told her afterward. Barbara's blood thinning level, a number called NR, had climbed from 2.4 to 6.1 in 4 days. The interaction is in the prescribing information. It's almost never mentioned at the pharmacy counter. Once the Bactrim was stopped and her blood thinner was held for 2 days, her levels came back into range. No permanent harm. But she spent 3 days convinced she was bleeding internally. That's one interaction. There are 5 more on this list. And the next one affects a blood pressure pill that tens of millions of seniors take every single morning. Now, what about blood pressure medication? If you're on an ACE inhibitor or ARB, this one's for you. Common ones are lisinopril, losartan, and ramipril. Research published in the British Medical Journal tracked older adults over 66 who were on these blood pressure pills and were given Bactrim. They found roughly a 50% higher risk of sudden death within 14 days compared to people given a safer antibiotic. That translates to approximately 3 additional deaths per 1,000 prescriptions in this population. The reason is potassium. Both the blood pressure pill and Bactrim block your body from clearing potassium. When they combine, potassium can build to dangerous levels silently. The sign to watch for is unexpected muscle weakness or a heartbeat that feels irregular. Most people wouldn't connect that to an antibiotic. If you take lisinopril, losartan, ramipril, or any ACE inhibitor or ARB, tell your doctor before you fill this prescription. There's also spironolactone, the water pill some of you take for fluid or heart failure. Research published in the British Medical Journal found that older adults on spironolactone who took Bactrim were more than 12 times as likely to be hospitalized with dangerously high potassium as those given a safer antibiotic. A follow-up study in the Canadian Medical Association Journal found a more than 2-fold higher risk of sudden death. Bactrim blocks the kidney from releasing potassium through one pathway. Spironolactone blocks a separate pathway. Together, potassium builds from 2 directions at once, with very little warning. The signs are the same ones to watch for: muscle weakness, a heaviness in your legs, or a heartbeat that feels irregular. If either shows up while you're on both, don't wait it out. Call. The next 2 medications on this list are the ones I see missed most often in the emergency department, because the warning signs look identical to the illness itself. If you take spironolactone, tell your pharmacist before you fill a Bactrim prescription, and if digoxin's part of your routine, for heart rhythm or heart failure. Here's what matters. The FDA's prescribing label for Bactrim specifically calls out this combination, and it specifically mentions elderly patients. This antibiotic can raise digoxin levels in your blood. Too much digoxin causes nausea, vomiting, a slow or irregular heartbeat, or confusion. Those symptoms can be mistaken for the illness itself. So if you take digoxin, your doctor needs to know before the first dose. If you take a diabetes medication, here's what you need to know. Bactrim can make your blood sugar-lowering medication work harder than intended. The FDA label confirms this for common diabetes pills, including glipizide and glyburide. If you're already not eating well because of this illness, and then you start Bactrim, your blood sugar can drop to a dangerous level from an antibiotic, not from your diabetes pill. You'd have no reason to expect it. Watch for shakiness, sweating, or sudden confusion. If you have any diabetes medication on your list, tell your doctor before starting. And for anyone taking calcium, magnesium, or iron supplements, keep listening. This one applies to the backup antibiotic, ciprofloxacin, prescribed when someone can't take Bactrim. The FDA black box warning for ciprofloxacin includes a specific alert. If you take calcium, magnesium, or iron within the same window as this antibiotic, those supplements bind to the drug in your stomach before it can absorb. The antibiotic becomes nearly ineffective. You take it every day and it's not working, and you don't know. Separate them by at least 2 hours before or 6 hours after the antibiotic. If you're on corticosteroids and you're prescribed ciprofloxacin, that combination also carries a significantly higher risk of tendon rupture, especially over age 60. Ciprofloxacin can also affect the electrical rhythm of the heart. Certain antidepressants and certain heart rhythm medications do the same. If you take either, this combination needs to be on your doctor's radar before your first dose. Before I give you the 6 questions to ask at the pharmacy counter, there's something else this antibiotic does. Something most people only find out when their doctor calls a few days later. It can make your kidney function look worse on a blood test than it actually is. Research published in Kidney International confirmed the mechanism. Bactrim competes with creatinine, the waste product your kidneys clear, and blocks it from leaving the body normally. Your creatinine number rises. Your doctor sees that number and may stop one of your other medications, thinking your kidneys are struggling, when they're not. If your doctor calls to say your kidney number spiked while you're on this antibiotic, ask specifically, could this be from the antibiotic itself? Next, there's a risk worth naming that has nothing to do with the antibiotic. It comes from the illness itself. Dehydration after 70 doesn't announce itself the same way. Research published in the New England Journal of Medicine found that older adults feel less thirsty, even when they're significantly dehydrated. Clinically, confusion and a suddenly higher fall risk often appear before thirst does in adults over 70. If a family member on this outbreak, antibiotic seems confused or unsteady and doesn't seem particularly thirsty, that's not a reason to wait. That's a reason to call. Grab a pen, because here are the 6 questions to ask at the pharmacy counter before you fill any antibiotic for this outbreak. 1. Are you on a blood thinner? Warfarin specifically? Ask for a blood level. Check within 2 to 3 days of starting. 2. Are you on a blood pressure pill? Lisinopril, losartan, ramipril, or anything in that family? Name it to your doctor before the prescription is written. 3. Do you take digoxin or a medication for heart rhythm? Tell your doctor before the first dose. 4. Do you take a diabetes medication? Glipizide, glyburide, or metformin? Name it before starting. 5. Do you take calcium, magnesium, or iron supplements? Ask your pharmacist how to time them around the antibiotic. 6. Do you take spironolactone for fluid, blood pressure, or heart failure? Tell your pharmacist before you fill a Bactrim prescription the specific question to say out loud at your appointment. Before you prescribe this antibiotic, I want to make sure you have my full medication list, including supplements. Are there any interactions I need to watch for with what I already take? That one question opens the conversation your pharmacy counter may not start. So, what happened to Barbara? Her blood thinning level came back into range 2 days after the Bactrim was stopped. The bruising on her forearms faded over the following week. She described it afterward as 3 days of being certain something was seriously wrong inside her, not knowing what, not knowing if it would stop. Her anticoagulation nurse told her the interaction was documented. It was in the prescribing information. It just wasn't in the conversation at the pharmacy counter. Barbara came through it without permanent harm. But her outcome depended entirely on going to the ER before it got worse, not on anyone warning her in advance. What I want to be clear about, this kind of drug interaction is very often reversible when identified early. Stopping the antibiotic and temporarily adjusting the blood thinner allows the body to correct course. In Barbara's case, that took 2 days. The window for catching it safely is short, which is exactly why the 6 questions matter before the first dose, not after. This is general health information, not advice for your specific situation. For your own case, speak with the physician who knows your full history. But now you know the 6 questions to ask at the pharmacy counter before you start any antibiotic for this outbreak, and why those questions could be the difference between getting better at home and ending up in an emergency room. If someone you love is dealing with this outbreak right now, and they take a blood thinner, a blood pressure pill, or a water pill, share this before they pick up their prescription. Their doctor may not have asked. Their pharmacist may not have flagged it. This is the conversation that should happen before the first dose.